What is depression? Depression is a mental illness. It manifests itself in the fact that you are persistently depressed, have reduced desire and interest, reduced energy, and are more tired than usual. Depression is a morbid condition that is not due to laziness, personal weakness, or lack of ability to pull yourself together. Things that used to make one in a good mood and happy are now indifferent and empty. You experience no joy neither with your partner or spouse, at work or education, or in leisure activities. The symptoms must have lasted for at least 2 weeks. What are the symptoms of depression? At least 2 weeks duration of the symptoms mentioned below: decreased desire or interest, decreased energy or increased tendency to get tired, decreased self-confidence or self-esteem, self-reproach or guilt, difficulty thinking or concentrating, inner turmoil or restlessness or inhibition, sleep disorders, change in appetite or weight. What should you pay special attention to? There is good reason to contact your doctor if you have felt persistently depressed or conspicuously tired. How is depression diagnosed? The medical history is the most important thing the doctor has to base himself on when making the diagnosis. It is important to be examined by the doctor. This is because it is common to have physical problems with depression, and it is important to distinguish depression from physical illness. Some doctors will ask you to fill out a form about depression. The doctor will also ask you questions to assess how severe your depression is. Some doctors use a different test for this. How is depression treated? Medicine? Antidepressant medicines, also called antidepressants. Antidepressant medicine work in several different ways. They make you more active, and fatigue and indifference decrease. The medicine improves sleep and appetite and helps with restlessness and anxiety. Conversation and psychotherapy are other forms of treatment that can be used. What can I do? It is important to live a regular life with regular exercise and a healthy diet, and without excessive use of alcohol. Exercise and physical activity can help the depressive symptoms and be a supplement to medication for mild to moderate depression. There are no specific types of exercise that work better than others. However, you should be physically active for a minimum of 30 minutes a day. It can also be an advantage to choose the types of exercise that you can do with others, as this can also have a positive effect on depression. It is important to recognize the existence of your illness and seek help. Depression doesn't just go away on its own. The sooner such a realization is reached, the better. And the sooner you get treatment, the greater the chance of a quick recovery.